Welcome to the Middlesex Moments radio show. I'm Dr. Anna Wasesha, president of Middlesex Community College, and joining me today is Mark Masselli. And we're going to be talking about the new Community Health Center building here in Middletown.
And we're very excited about that.
I would think so.
Yeah.
I have to say, I got a chance to see it, and I think everybody listening to the radio show should go over and take a look if they can. I don't know if is it all right for people to just come in?
We welcome everyone to come by, and we've already hosted a community tour early in May. We kicked off our 40th anniversary. May 1st was the founding day in 1972 for the Community Health Center. So the first week in May, we held a number of celebrations, sort of honoring and saying thank you to the citizens of Middletown who've helped us out so much over the years. A special dedication to Senator Chris Dodd for the work that he's done in healthcare. And then we had a 40th dinner party, and we had our good friend, the governor of Colorado, John Hickenlooper, is one of our founding members, along with Governor Dan Malloy. So we've had a weekend of celebrations, and as well, we did an open house that Saturday for the public. And there are more to come. So we welcome people to come by. Really need to schedule those, and we'll be putting out schedules so that people can come and tour. Really a very remarkable building.
Yeah, it's totally astounding, I have to say. I had a little bit of a comparison in my own head because I used to be on the board of the Green Institute in Minneapolis. Mm-hmm. And the Green Institute building was designed, first of all, of course, the work of the Green Institute was to promote environmental sustainable action on the part of communities, on businesses. They were working on a biomass generating system to take the waste from the city of Minneapolis and turn it into energy. But the building itself was supposed to demonstrate all of the principles, and it was astounding. But your building's more astounding, I have to say. And I think that's partially because the technology keeps changing.
That's right.
There's always something new. Mm-hmm. So, for example, your carpeting. Let's talk about your carpeting.
Well, the carpeting is zero emissions carpeting. And so it's Intermountain, which is a group that produces recycled materials. But it comes in such vibrant colors. I think one of the things that's astounding, the wide range of colors. And they're an internationally known group. And so there's no glue when you put it down. It's just tape on the edges of that. So again, we want nothing to emit into the air in terms of vapors. I've been surprised by the number of people who've come in and said, I don't smell anything. Now, these are people with very sensitive noses who, if there's vapor wicking up from the furniture or from the carpet, they're allergic to it. So one of the things we really tried to do, and the carpet's fundamental to that, but all of the products within the building really are focusing on is little vapor emissions as possible.
Right.
Or none.
Low VO, right?
Low VO.
Yeah. So, and when you're finished with that carpet, years into the future, when it's been worn out, mm-hmm. Does Intermountain take it back?
Well, they have a recycling system, and they're also able to, they come in squares, so you're able to rotate the carpeting. Mm-hmm. So how in our homes, maybe the normal wear and tear that goes on the broad loom carpet, that doesn't happen. So you can move these tiles around, and so that the wear is longer. So it's got a couple of design elements. But the larger thing is really the building itself.
Right.
I
started on the ground floor with the carpeting.
And one of the things I've been really quite amazed at is so many people, including Congressman John Larson, I don't want to get him in trouble here, came in and said, what a great rehab.
Oh.
What a great rehab. And now, of course, my architect loves that because he designed the building to fit into the neighborhood.
Yeah.
But so many people come in. Now, of course, those of us in Middletown, we know it was a parking lot. But for other people, they come in and say, boy, you've done a great rehab because of how the outside looks. It fits into the character of the neighborhood. That was one important element that we wanted to capture.
Yeah, and well, you did beautifully. Yeah. Okay, well, we have to take a break, and when we come back, we're going to talk some more about carpeting and everything else in that building. Welcome back, and with me today is Mark Masselli from the Community Health Center here in Middletown and all over the state of Connecticut. Yes. And we're talking about the brand new building in Middletown. And I do want to go back to the carpeting because the other piece of it is that the designs on it are supposed to be, I think, biomimicry. Is that correct?
Yeah, they are.
So what is biomimicry?
Well, really, it's trying to pick up patterns within the, I think as it's described to me, and I need my architect here right now, but I think it's trying to mimic patterns in nature and the like.
Right, yeah. And we have a faculty member here, Steve Kravisky, who works on Fibonacci numbers.
Yeah.
I mean, and the patterns that are replicated in things like sunflower seeds and things like that. It's just fantastic. Yeah. I mean, I don't know what that does to your brain. I mean, is there
Soothing.
Yeah.
All of the, one of the things about the space is there's a sense of dignity as you walk in, about height. And he is very thematic about his tying back to human emotions, and all of the work that he does is very respectful. And as you walk through the building, there's this sort of natural wayfinding because of his use of natural light. So the building has a couple hundred windows in it, and you know where you are all the time. And that's very important, the relationship you have to your outside. You're not lost in any way, and that's very important to him. So there's a lot of elements that go into his design. Quite a remarkable architect, Robert Olson out of Cambridge, Massachusetts. He's done a lot of work here at Wesleyan, at Harvard, and sort of a Renaissance person, really draws on a lot of the great traditions in architecture as he thinks through the project.
Had you ever worked that closely with an architect before?
Not as intimately on a new building, though. We've used Rob in our Waterbury and Bristol site and New London site, but nothing as big as this. And, it's a long process, and, they really want to have a conversation with you. Mm-hmm. Architecture is all about a conversation and trying to get understanding the next larger context, right? They're always thinking about how this sits and trying to describe it in the next larger context that we're in. So here we are sitting at a table, but we're in a room, and we're in a building, and we're on a set of buildings on a beautiful hill here in your office. So he's always thinking about the interrelationship between those. It's quite fascinating.
And so to go from the carpets on the floor to the roof garden, the next larger context is also, it has to be the Connecticut River and the Argonne Bridge. I mean, it's absolutely incredible.
Yeah, no, there are beautiful views there. But the rooftop, we have about 15,000 plants on the rooftop. So we both have horizontal and vertical gardens. And we have vertical gardens. And let me just set the backdrop of this. Well, I'm very fascinated about healthcare, and I could talk all day long about it. The reality is younger people and so many of the next generation, the environment is critical. And they're thinking about this all the time. We wanted to have the building had conversations at a number of levels. So being green is important because it has cost savings. You may pay a little more up front, but over the life of the building, you will save an enormous amount of money. And so what may look frivolous or decadent or whatever, really, as you look at and measure the cost over a lifetime, enormous savings for us. But also there's this movement coursing through the veins of our next generation about its relationship to the environment. And so the green roof is a great place to have that conversation. It's also a place where the McDonough School children now have a number of gardens. So their gardening club will be planting all summer long, and there are about 30 of them, and they've been up there planting away. Most of the garden has perennials all over it, but there are 7 beds for gardeners. And I welcome anybody, Anna, who's listening now. If they're an avid gardener and want to get together with a group in the community, we'll have a plot for you as well. You have to be chaperoned up there, but it's a wonderful space. Gardens are a place where people come together and plant something in common and watch it grow and nourish it and the like. So it's very exciting. But also the aesthetic beauty of it is a nice space for reflection. And so our behavioral health people oftentimes bring patients up there. It has a community room, sort of a glassed-in pavilion there, and it's a wonderful space for groups to meet and the like. And obviously, we use it a lot at the health center.
And you were just saying earlier to me, before we started the program, that you had had all these visitors from other places who wanted to take a look at it. But out west?
Out west, we've had folks from just this morning, Arizona, last week, Wyoming and New Mexico. And, the one nice thing about the work of the health center is that we have maintained a national profile. So people know about us. They've seen the video of the building online. They've heard about it. And people are thinking about how do we design the next generation of healthcare facilities. make them efficient, effective, and elegant. And that's very important to the work that we do. We're not your grandparents' health clinic. We're really thinking about how do you redefine and redesign the space that we're in. And buildings are very powerful. We have a saying at the health center, what the eye sees, the heart feels. So we should be able to send a message, and I think all architecture and all building design is around, I want to send a message before I speak and say good morning. So that's the work that we've been about, and people are coming in to take a look at it. As we look at other people and the work that they're doing, there are a lot of great, we're inspired by other work that's going on in terms of the green architecture, and there are a lot of great people working on it. So we're not the only people, as you well know,
Right.
working in this area.
But I love the fusion of the healthcare and the green world piece.
Mm-hmm.
There's a fantastic book called Restorative Gardens by a man named Sam Bass Warner. And I got to hear him talk about it. And it was so remarkable to kind of realize that the first kind of healthcare facilities, if you think of them that way, were medieval inns that were surrounded by herb gardens because herbs were our first medicine.
Absolutely.
And then when you kind of move forward in history, there was we call them in Minnesota the Kirkbride movement, but it's the mental health hospital system that the CVH is actually representative of. Mm-hmm. And Kirkbride was a psychiatrist who believed that all individuals who were being treated for mental illness needed to be able to see the green world, right? Mm-hmm. So that's why they tend to be long and linear, because every room has a window out to the outside world. Then there's a whole body of research, maybe your architect worked with you on this, about how people who see even images, photographs of green things will heal faster, need less pain medication, get into a more contemplative, healthful state as they're recovering from illness and surgery and things like that.
Color, green. I mean, there are a lot of elements that go into sort of health and wellness. I should note that we also celebrate the 20th anniversary of our Louis Lopez Herb Garden, which is on the corner of Green and Main Street. We planted an old world herb garden. It
has that black iron fence
around it, and the Korean
beautiful.
boxwood, and it was all designed around plants that were healing plants that were indigenous to various groups within our community. So we've been thinking this way for a while. We got to put it all together in one building.
Yeah, that's fantastic. Well, so when these visitors come from afar, what are they most interested in, do you think? I mean, what do you think they're going to take back with them?
I think that there's the elements of the aesthetics which people take away. But, we've also been thinking about how primary care is delivered. So people come to us because we've redesigned. When we started off, all of our providers had single individual offices. A nurse had an office. The MAs were sort of a gaggle in a room. And something called pods has come up and been developed where a group of providers, two MAs, a nurse, a behavioralist, maybe a podiatrist, somebody who rotates in, a dietitian or the like, sit in what's called a pod. And actually, this has become the state of the art in the delivery of primary care. So they are a team, and we have 6 of those pods in our building. And outside a pod are 7 rooms, 6 medical, 1 behavioral health. And they work in that context. And we do something called an electronic huddle, because everyone has a laptop, an iPad, or whatever with electronic records are all on that, and they huddle together. Well, believe it or not, that simple intervention is a key improvement research element that's going on in the transformation of primary care, which I should say has not changed since the horse and buggy, pretty much, in almost every element. But there are a whole group of people. We're involved with the Dartmouth Institute, GE, a group out of Sweden, and Sweden actually is the premier researcher in primary care, on how do you change the system to get better outcomes. And a lot of the ways you get better outcomes are working in teams and doing care coordination. So the pods are an interesting design that we've gotten to an art form. They're very elegant spaces. People have individual desks. They have their own computers. But
there are no walls between them.
There are no walls in that thing, but each pod is a separate one, so each group, and then they have their own patients that they work with and in their own space. And we have the pods identified as an apple pod, a butterfly, a cardinal, hint, hint, Wesleyan, a daisy, an egg, and a fish. So people go to their pod, and they have a provider who they always see. And that provider has a team that he or she works with who are really thinking about the broader issues of them. And primary care is really moving into the area. Specialty has sort of dominated where all the expenses are, where all the activity is happening. But unless we improve the work that providers do in primary care, we can't solve the larger healthcare issues.
I'm afraid we have to take a break, but when we come back, I would love to explore this pod idea more with you because I have a feeling that it would extrapolate to higher education and how we provide student services. So let's take a break and come back and talk about it. Well, welcome back. This is Anna Wasesha from Middlesex Community College, and I'm talking with Mark Masselli today about a million different things, mostly focused, I guess our anchor is the new building, the Community Health Center building, but the ideas that emanate from that building are so huge and they're fascinating to me. So I was just before the break thinking that the pod idea might translate actually very nicely to higher education because we talk about addressing the whole student and holistic advising and all, but we tend to operate in silos.
Sure.
I wonder if we're lagging and you're leading. Healthcare is leading and higher education is lagging, but maybe we could bring it up a little bit so I would love to come and see how you do this.
We'd love to have you there. And I think this interdisciplinary approach to, in the holistic approach, we now call them in healthcare patient-centered medical homes.
And we talk about student-centered
right.
colleges.
So, we're really trying to figure out how do we bring people together to collectively think about sort of what's the critical thinking that's needed about getting the patient to the next step. Clearly, the patient's part of that conversation, but in the pod, we're trying to think through what are the elements that each team member brings to help with that transformation that the patient might need to have to go through or to stay on track with. So the pods are one nice way to do it, but it's got the elements in there of the electronic huddle, of the different intervention strategies that we're always looking at. We don't have all of the answers. So one of the areas that we're engaged in is research and innovation, because what we realize is we have a part of the answer or we have a nice narrative and it isn't supported by the data. Mm-hmm. And so the research component of the health center, we sort of have a 3-pillar operation. So we have a lot of work going on where we do something Plan, Do, Study, Act, PDSA models, where we're trying interventions, but we're trying it and measuring it up against the data and outcomes. And a lot of times what we find, great idea, it sounded wonderful, but it didn't change patient outcomes. You really got to throw it to the curb.
Yeah, right.
And then you've got to move on. So part of the culture of primary care, what makes us a little different is that we have a very large research arm that's doing improvement and implementation research. And, we've been funded. Yesterday, we just got a grant to add a group from Arizona into our Project Echo, where we actually do teleconferencing across Connecticut and now with other states, where our specialists in Hep C and HIV educate the primary care providers so that they can better treat the patients so they don't refer it to a specialist. And this is happening now in all of the ologies, that are out there right now. And so there's a lot of work going on that. So that's one element, but we're looking at ways that we can strengthen and improve the work that we do. And the only way to do that is you have to bring some scientific rigor into this and really look at the data sets. So as much as we're a healthcare company, we're a data company. Mm-hmm. We're looking at the issues and trying to think through, do these interventions that we've put forward make a difference in outcome? And there's a lot of exciting work going on in that field. We have a whole initiative going on with a group out of New York City on pain management. And that's really a very complicated area of how do you address the issues of pain. We're working with the VA, first health center in America to have a partnership with the Veterans Administration. They've done some great work, and they are really the premier primary care system. And I know the VA gets a lot of flack here and there, but when people talk about them, the Mayo Clinic, when they talk about Intermountain Health, they also talk about the VA. So we're looking at their system. So we have a lot of physician scientists who we employ who don't do clinical work, who are just engaged in research work. And that's the work that I've talked about with either GE and their lean improvement people or the Dartmouth Institute, which is a leading group in the United States. thinking about ways that we can improve primary care.
Where are your scientists located, your physician scientists?
Right here. Middletown happens to be our headquarters, but our research is all across Connecticut,
Sure.
so they are able to do it. We're as high-tech as it gets probably as an organization. Mm-hmm. Every site has large Tandbergs. These are video conferencing systems. There's the ability to do this on the fly. You can be in a live conference off of your iPhone with us. We have a lot of technology that allows to bring people in from far and wide to be part of what we have, these virtual grand rounds. So we're engaged in a lot of activity with them, but the hub of that work is based in Middletown, and we've probably gotten $1.5 million in the last year just in our research areas. So we have a lot of people looking at the work we're doing and supporting our work, and we're working with others to learn, and hopefully there are a few teachable moments.
Yes. There have to be teachable moments. I mean, it's quite a remarkable thing to consider that you don't have to be. We have to break through all these plate glass windows, so you don't have to be in a major metropolitan area with access to specialists in order to get the kind of health care that you need. I mean, that's one. I mean, I would think the community health center, in a way, your grassroots beginnings would have meant. Help me, because I'm a newcomer. Sure. That everyone has the right to high quality medical care,
sure.
No matter your station in life. But also geography plays a huge part in that, because if you're and I just speak from experience, having lived in a rural area for the last 4 years mm-hmm. before I moved to Connecticut, and healthcare really does suffer by virtue of the fact that you're just not near it.
Sure, and that's a really good point. We started 40 years ago when a group of Wesleyan University students, Middletown community activists, came together really under the banner that healthcare is a right, not a privilege.
Right.
And we've been trying to sort of break down the obstacles for access. And we, I think, done an effective job on that. Now we ask ourselves, access to what? And that's really where you start to do the qualitative work. But the issue of specialty service and access is a daunting one for primary care, particularly with populations who can't afford it. So we've been leading the way on a couple of areas. One's called an e-consult, and then it really leads into sort of a telemedicine intervention. But we looked at the work of Mitch Katz out in San Francisco, a noted physician, where he was simply saying, look at, when we send a referral to the physician, so often what happens is the patient goes to the physician and the physician says, you needed 2 more diagnostic tests. One safe visit if we can solve that problem. Second thing is, I could have helped the physician at the primary care manage this. Hypertension, could have done more ACE inhibitors. Or 3, bingo, perfect referral. The e-consults allow us to try to eliminate the first 2 visits and get to the right visits. Because think about it, if you're in New London and you're poor, the only place you can get specialty services is at UConn. So they have to drive in a taxi up there and back. They get up there and they're told, oh, you needed 2 more lab tests. Well, e-consults is about a virtual visit with a specialist who we employ, who can help our providers doing that. And then it leads to a little more sophisticated look at these telemedicine visits, which we're promoting, common in California and Arizona, places with huge spreads,
right.
Less common here, and we're hopefully going to do some groundbreaking work on it this year with the state on this.
That's really great to hear. Well, we were running out of time, but I do want to ask one more question, which is, when you do, research needs to be disseminated somehow. So, are you is your group, are your physicians and scientists actually publishing, or? Yes.
It is a standard. You cannot work at the health center unless you publish.
Okay.
So we probably had a couple dozen publications that are up on our website in this last 6 months. We're published in all the major journals and the work that we do. So you have to not only be a scientist, but you have to publish. And exactly. The last thing is we also run 2 residency programs. So we have a whole educational arm now. First nurse practitioner residency program in America, now in its 5th year. Have 8 people coming. Couple hundred people applied to get in. So education is a very important element, and educating them to the model that we're designing.
Right.
Yeah.
Well, you're definitely riding a wave. Mark Masselli, it's been so great to have this conversation with you. I hope you'll come back.
Yeah, I will.
And I want to come visit your shop and see what those pods look like. This has been the Middlesex Moments radio show, and if you're interested, you listeners out there, in learning more about the college, you can go to mxcc.edu and read about it. And the Community Health Center, I know, has a website. What is it?
CHC1, that's the numeric 1.com.
All right, good. So take a look at that too. I'm Anna Wasesha, president of Middlesex Community College, wishing you a good day.